Okay, thank you very much, everybody. We have our speakers on the panel with us, but we have an additional person joining us, Irma Ranieri. So Irma, welcome. Most people would know Irma, but I'll formally introduce her as the Commissioner for Public Sector Employment, and she works passionately to ensure the public sector is a trusted, respected, courageous and honest organisation.
Oops.
Whoops. No challenges there. Irma's working towards creating a world-leading public sector serving South Australia. I think most of you would know Irma and have worked with Irma or interact with Irma in some way. She's worked for more than 30 years to help organisations optimise productivity and employment wellbeing, and of course she was the 2014 Telstra Businesswoman of the Year and winner of the Telstra Community and Government Award for a role in leading transformational change in the public sector. So welcome Irma, and welcome to the speakers from our previous session. What we'd like to try and do now in the time remaining through to about 12:15, is to really have some good interaction and dialogue, picking up from some of the messages and points that were raised in the speakers earlier, but to generate some good conversation and perhaps dig a little bit deeper into some of those points that were raised. And I guess we've heard a number of perspectives this morning about disrupting the silos. Hopefully you've had some time to reflect on that. I guess the challenge now is, what are the key questions that we need to ask? Okay, and how do we turn the words into action? We've seen a number of examples and case studies and some things that are really happening well, but I'm sure there's also a lot of frustration that's comes about in many situations where people want to collaborate, they want to partner, they want to work with others, and there are barriers and roadblocks in the way. So how can we move to a space where the silos within organisations and sectors are not obstacles to better outcomes for the community? You know, and I think we had an excellent example of that in the MAPS exercise, you know, and we were talking about that afterwards at one of our tables, that the situation is that the outcome of that is saving people's lives, you know, and saving people from injury and domestic violence. So it's such a critical issue. So perhaps just to start the ball rolling, I'm sure you've got many questions there, but I'd just like to pose one to the panel to start off with. And that's, given what we've heard this morning, and we did hear from the Minister, for example, saying that, well, we need to have silos, the vertical silos for accountability, but we need to see how we can work more across silos. Given what we've heard this morning, is it possible to do away with silos? Are they necessary? And if we can't do away with silos, what will it take to bridge those silos more effectively? You know, so what are some of the things that we can do in a tangible sense? So I'll throw that open to the panel, and who would like to go first? You want to start from this end? How about Ruth?
Well, look, I think we do need silos. You've got to have some structure. We can't just have a blancmange, given that we've got, if you're just talking about the South Australian public sector, we've got about 100,000 people, I think, haven't we, Irma? Something like that. So, you know, people need to have some certainty and understand what their job is to a point. Having said that, I do think that there are much more collaborative models that we can use, and I'm really attracted to the idea of having more kind of action teams, I suppose, where on particular topics we might bring a group of people together, and whether they're co-located or not, I think co-location actually does help, as Joe was saying earlier in the MAPS example, but bring together the right people from around government to fix a problem. And so it doesn't really matter what your job is, what matters is what your skills are. And we get those people together, and, you know, whether it's for 6 months or whatever, and we work intensively on something. So I think it's those more flexible models within current structures that are important. And getting back to some of the things the Minister said, I also think, I mean, I'm a bit of a fan of having another go at the multilateral budget bids as well, because I think, you know, often people follow the money.
Okay, thanks Ruth. Others? Yeah, Irma, do you want to add anything to that?
I agree with Ruth to a certain degree around silos, but I guess the word silo itself is created by individuals. So, in fact, you know, the people that actually have those relationships and work with other people go and find it anyway. So I think that you often get delivered what you measure. So my view would be that even though I agree in terms of accountability, you need to actually hold the people right at the top, that might include sort of ministers and the rest of it, to collaborate. So in fact, if that is part of the measurement, is to get people working across, then you can bet your bottom dollar that people will actually be focusing on it. And I think, I mean, Ruth's hit the nail on the head, I think that the MAPS is a really good example of what Colocation can actually do, but that's only one part. What you did hear was what sort of a great leader can actually do to get people working together. So when you have your 4 milk cartons and your different coffees, mind you, great coffee shops on where they are, so we should make the most of that. It's those little things that actually ruin, I guess, a culture or stop it from actually being collaborative. And I think we can't downplay enough what culture does and what's rewarded. And what's rewarded is you come in on budget and you do that as a silo. And so that whole paradigm actually has to shift. And I think human beings that work in the public sector are probably the powerful ones that can actually do that and can break some of that down if we hold the top to account. I think Peter mentioned it, where you do bottom up and top down.
Okay, thanks. Fran?
Yeah, I think it's partly also at what level are we talking, and I think locally co-location makes a lot of sense, and I think who was talking, you were talking about the Ananju Pettiginjara lands and how we have the APY lands. But it seems to me that the really crucial thing is how do you get this focus on prevention instead of on crisis and cure, and that to me is the bigger issue, because people come together in a crisis, and I think MAPs work because there's an element of crisis there. And, you know, look at our hospitals, and our hospitals actually function really well. They function around, you know, dealing with people's illness. I think the real challenge is how do you actually fund the stuff that keeps us healthy, that keeps people non-violent, that keeps things sustainable. And I think Peter's point about the dangers of, you know, privatising everything and not having block grants is really important. And I also think it would be great for the public service to take the attitude, well, there isn't going to be one size fits all, but let's have 1,000 flowers blooming. What works in Noarlunga might not work in Playford and vice versa. And how do you have a public service that can do that and can look for what is and isn't working? So I think, you know, fit it to scale. Is it local? Is it middle management? Is it higher? And we probably need different solutions at those different levels to get that joined upness.
Great, thanks. Peter?
Once upon a time I sat on the Youth Pathways Task Force, about year 2000, and Captain David Eldridge then went over to New Zealand to investigate. This was a Commonwealth State NGO and government task force. Dave Eldridge went over to New Zealand and came back with how they run youth services over there. And they had a saying, which I've always keep repeating, and the Anglicare people have heard this far too much. No young person should suffer because of our inability to work together. Now, if you apply that to different population groups, how they made it work, and it's easier in New Zealand where they're you know, one level of government, but the Cabinet would sit around the table and the Premier would say, what's happened to the Jones family? And the ministers would have to say what their departments were doing with the Jones family, and they'd rush off and get their CEOs and they had to say, what's happening with the Jones family down the line? So that there was, from the very top, a concern to drive the collaboration down every level. Now, it was a mechanism to ensure that the collaboration was rewarded at the Cabinet table. Unless that happens, we're not going to get the type of working together at the deep level we need.
Fantastic, excellent. Joanna?
I tend to think that, and having been a police officer for a long time, starting at 5 of course, that, you know, years ago, I didn't start when I was 5. Years ago, we actually used to have, we broke down those silos. We actually did communicate across agencies a lot better. I was a detective at Port Adelaide CRB. I could ring the local health network. I could ring the local families office, and we would have that relationship going. 10 years ago, something happened, and we actually started siloising. I don't know if that's a word, but that's the Greek in me coming out, making up words. But we started building all these silos, and we didn't talk to each other. In policing, we have to have the vertical silos because we're a paramilitary organisation. If I tell someone to stand in the rain, they have to stand in the rain. So we expect that with the level of rank structure that we've got. But I think we've had it happening. It's stopped, and I think we're at that age again. And rightly so, that it's time that we broke down those silos and we sat next to each other and broke down those barriers. The next challenge, I think, for us in government, in particular sort of for policing and in the field that I'm in at the moment, is including the NGOs in that environment, and that's one of our steps. We've got to get the government part right and get that modelling right, and then once we've done that, it's the NGO sector and a whole lot of other areas too that would come in.
It'd be good to have the NGOs in from the beginning, actually.
We didn't have enough sort of pencils and sticky tape to sort of put things up on the wall, but we would have liked to have, it was a big project. So to actually have had them in...
We're very happy to be part of big projects as well.
Okay, we should have had them in at the start. They were in the documents, but it's phased, so you'll be phased in.
Okay.
You'll find that we collaborate best when we're in from the beginning. It's not just the police. It's not what's happened in recent years in Families SA. Reorganise Families SA and then organise the NGOs around that reorganisation. Come on, nod, Graham. Yep, that's right. It's really fundamental. If you want to collaborate, have the partners there from the very beginning. It's not good enough to then come along and say, collaborate or you're nicked.
Okay. Just to finish on, while Joanne and Peter start to form a new...
I have been a hostage negotiator as well, pulling people out of sieges, but I'll take that. You can have a little win.
Okay, so you can see the seeds of a new collaborative relationship starting here between Joanna and Peter.
Yeah. And my name's Graham Brown and I work at Junction.
Okay, I'd just like to ask Aman, did you have any comments about the silos and from an outside community perspective about what it takes to
the panel did a wonderful job at answering that. What I will do is I'll just make a couple of quick comments. I guess, when we're speaking about whether if you want to call it silos, departments, systems, what comes to my mind is a fluid system, so something that encourages information to go from, one place to another with ease. And I guess when you sort of look at this system as a whole, they have a common goal, they have a common objective. So having that information available right across the board really makes sense, because at the end of the day, the entire team is working towards the same thing. And I guess if I was to sort of look at the legal system, speaking about systems, is that it doesn't serve its purpose if it's not protecting those who need to be protected. So I think I'll just leave it at that.
Okay, great. Okay, so we've heard some really good comments from the panellists. So what about some questions from the floor? Where do we go? Perhaps Jane down there? If you could wait for a mic. Perhaps you could just say your name and organisation where you're working at the moment.
Jane Russo, currently at SA Health on the new Rev'd project. Question I've got, there are a number of across-government policies or mandates that have been put in place, such as open data, such as the Better Together principles of engagement. But what I'm not seeing is that they're put in place, they're slightly implemented, and then they seem to fade away. And my concern is that you've got bottom-up, people like myself, Jason Downs, a whole pile of other people, Jess, campaigning, championing, trying to get this upwards momentum. Where I'm finding it's getting stuck is, yes, CEs have signed off on it, said that we're committed to this, but it might work for a while and then it gets lost. So then that culture of the change that some of these mandates are trying to in place to have that holistic approach that we want all of government to be working towards, so that we can then go out and work with not-for-profits at the beginning. The first principle of good engagement is engaging them early. Then the practice is starting to there. I know it takes time, but what I find is it's done, and then a year later, 2 years later, we've lost it again. And there's some good work that's in place, and I'd like to see that continued, I guess. But just to me, that's the challenge, and I just want to ask how are you going to fix it, Irma?
Thanks. Well, I guess we'll direct that question to Irma, shall we? Okay.
Well, I guess the only way I can answer that question is through my own story. So I think I'll be bold here. Introducing frameworks to engage with people and then imposing those frameworks on, and they're all good, by the way. The one thing I knew when we did the reform program, and just what we're continuing to do, is that you actually don't need to necessarily concentrate on getting the very best framework in place. You just need to concentrate on the people that are passionate enough to actually get some things changed, which we've got here. I mean, whether we were able to find a space for the maps or Jess trying to find different things. There are individuals that actually want to make a difference. And I think we need a sector that actually creates the opportunity for those people to make a difference. And at the same time, which is what I'm trying to do, is to now shift the institution to get rid of some of those rules that stop people from working, to make chief executives accountable through their performance agreements on collaboration, and to then use those things that you talked about merely as tools. Because some people are terrific at engaging and others are not. And then my boldest statement is that the 25,000 or whatever middle managers who get rewarded for managing their budgets and doing the things that they need to do, and you need to have that you choose leaders and you develop leaders that are actually accountable for the cross-collaboration. In fact, some of their KPIs are that you have, you connect in with police or whatever, depending on what your job is, that actually becomes a critical key performance indicator. And it's only then, when you actually start to talk about that level of accountability, that you'll find a bunch of people who actually are very innovative. By the way, public servants are innovative. We are the largest employer, and we will be the make or break for this economy. Because if we don't unlock it, deal with the NGOs right up front, deal with unions up front, the community of South Australia will not get what they need to go forward, and the economy will not grow. It's, I think, as desperate as that. And it actually really comes down to leadership and accountability for doing it differently. Great frameworks in place. They cannot be led from a centre. They are led by human beings, and the public service are human beings. They also are community. So it's actually quite a complex issue. You all have a part to play in that. And everyone should be empowered to take some sort of risk. And we should actually give you the kind of the mandate, as in leaders, to make sure that you don't get trampled when you do take that risk.
Great. Thanks, Emma. I'll just leave it that if any other panellists really want to jump in, please do. Ruth, I don't know if you want to add anything to that at this stage?
Look, I'd probably just add, if there are some things that are frustrating you, Jane, come and talk to us in Cabinet Office. Obviously, seriously. Yes, and not to say that we can promise to fix it, but because we do have that central, as you would know, have that central agency view. If there are some things that are blocking you, it's again, our job is sometimes to try and unblock. Yeah. So,
and she's doing a great job of that.
We're trying.
Ian,
okay.
Can I
yes,
just
Frank,
add?
yeah.
I just wanted to pick up on the point you made, Joanne, about how you used to be able to collaborate at Port Adelaide. And I would suggest at Port Adelaide we used to have a great community health centre that did a whole lot of preventive work, and I bet you collaborated with them. We have another NH&MRC funded study of the community health sector, primary healthcare sector in South Australia, which has produced evidence after evidence that our great community health workforce was given explicit directions that they could not collaborate across sectors. They had to withdraw, and I can see Graham nodding, and anyone who works in the communities will know that. So we've had an agency that has said to the community health workforce, you are not allowed to continue with the collaborations that you have. And if you talk to, as I do, to communities across the state, that's had a massive impact, and that was the preventive work we were doing. So while that's the intent of government, what's happening on the ground is a very, very different story. And, we will be reporting that internationally, that this has happened in South Australia, and it really pains me, because when I used to go overseas, talk at WHO, we were the wonder of the world, and that's all been lost, and I think that's really sad.
It's really interesting to hear the different drivers in place, isn't it, in terms of what's encouraging or not encouraging collaboration. Actually, I'm amazed to hear that, I have to say. I wasn't aware of that, and if that has been the situation.
We need a backup.
Yeah.
Just on that issue, it's going to be very interesting in the primary health network sector, where they're going to be taking on a commissioning role. I mean, it begs the question, how could they commission if they don't collaborate?
How do you mean the primary health networks?
Yes.
Well, I think we have another funded research project where we're looking at the Medicare locals and the transition to the public health networks, and they're federally funded. And I think the Medicare locals were doing a reasonable job, but the difficulty for many of them in South Australia compared to those, say, in Victoria, where they do have a state government that's putting an emphasis on prevention and promotion, was that it was much easier for them to collaborate there than it has been in South Australia, where there's been a disinvestment in that sector. So I think, you know, the success of the primary health networks is going to depend on the states that they're in, and I think that will be variable across the country.
Okay, so let's move to some other questions from the audience. Yes, over here.
Yeah, Graham Brown from Australia. Irma, very much loved your comments there and that commitment to the work that you're doing.
Don't tweet.
But I think that it seems to me we've got absolute agreement at the top and the bottom of South Australia's system. If you ask the Premier, what is the outcome that you want, he would say, well, you know, as an example, one of those state strategic priorities, every chance for every child. If you ask the child or their parent, what do you want? I want every chance for my child. In between that, we've developed this huge diamond of complexity, which is segmented streams of what would help to give that child every chance. And I think earlier today you were talking about, or we're recognising there is value in the silos around accountability for public, use of public power and resources. But Irma, I come to your question, how do we actually, what mechanisms can we put in place to authorise and validate the sort of the change champions that actually have the headset and the leadership capacity, etc., to work across those silos where appropriate? How can we, what else would we need to do? It might be you've already got a plan for this, and I'd love to hear it, but there are people who want to work across those silos and have that capacity. How do we identify them, validate their efforts, and empower them to get on with the task?
It's me again. Look, I think we've done a bit of that, not enough. But I was talking to Peter earlier that now more than ever the government does need to change, because with things like NDIS and sort of the user pays or has choices, you know, in a way government hasn't got a monopoly on that, and it has to reinvent itself in terms of how it's going to do business, either being a policy maker or having stronger partnerships with NGOs. So I think, well, I know that the Burning Platform's been here for a while. In terms of how we go about it, I think change takes a long time. And there's people in this room that have been on that journey with us. They self-selected. So people within their own agencies had said, I want to make a change. In fact, I've got the idea for you. We've had a program where we do have these sort of 90-day projects. Jess has been leading that. There's been 71 of those, and each one of them had something quite unique that came out of it, even if we failed and got out. So we've got a formula for how it actually works, and I have heard the Premier say, why hasn't this been embedded across the agencies? Why isn't everyone just doing it? I don't want to have a unique group, and I don't believe in having a centralised group that's going to be the change agents. We need it. We kind of need someone to go in there and actually disrupt, who's not going to get hit over the head, or purely someone like myself actually saying, we're going to make this happen, and I'm happy to take the sort of the brunt of that. And that's, in essence, what the culture is. You know, finding a space for maps or doing something for someone else is just the bit that someone needs to get something done. So I think finding change champions is about being clear about a leadership strategy, which we're doing. At a whole of government level, that's going to happen. And that leadership strategy is all about picking people or developing people that actually have that at the core of what they're doing, rather than technical expertise. You might need that, but really leadership plays a very big part. And not all of us are really good at managing change and actually dealing with that disruption. We need to find the people who've got those skills or build those skills and say, we're going to measure you for that, as we will for chief executives. So that's fundamentally sort of, I think, a sort of medium to long-term proposition. Someone mentioned in their speech around political cycles. I think it'd be foolish not to know that that happens. But good public servants know that that has to be delivered. But whatever you do is a building block for 20 years down the track. And I think that's what we need to do as a sector, and know that we will always have political masters. That's what it's like, that's the system. But what are we doing to actually build, to make this a better place for South Australia and for the citizens of South Australia? And I think that's the sort of thing we need to actually develop across the public service, is that we are here for the longer haul, for the long term of this state.
Okay, thanks, Emma. Peter, you want to make a comment?
One of the reasons that I personally am very interested in the community services sector participating in IPPA and more of this is people like Graham and myself. We run relatively large organisations, and frankly the degrees of freedom you have as a senior manager of an NGO compared to a public servant, we have many more degrees of freedom.
We do.
So that brings a responsibility to be part of the change as well. And I think that's really behind Graham's question, I suspect, is that the coalition with NGOs really do help public servants trying to bring about certain changes, because we can speak out. We're not trammelled by the thought that we're not allowed to speak in public. And so often there are opportunities, I think, that we sometimes miss because we haven't built the trust and reciprocity between the government and non-government sectors. And for those of us who've been public servants and are now in the non-government sector or vice versa, those alliances will actually help bring about change. And I think so I agree with the premise of the question.
Great, thanks. We've got another question from the audience at all. Yes, down here in front.
I'm Carmel Rosier from the Community Housing Council, and I actually want to ask a question about NDIS. We all know a lot about NDIS. We probably know more about what we don't know about the NDIS. And we know that there's a lot of conversations about the NDIS, but I haven't seen any evidence that there's any joined up conversations about the NDIS. So we know government agencies are doing work on NDIS. I haven't seen anything to indicate that government agencies are talking amongst the agencies. I haven't seen any evidence that they're talking to NGOs. So from a community housing perspective, we obviously have an interest in what Housing SA might be doing, what Disability SA might be doing. And so what do you think's stopping something that's from happening about that, given that we know that the community has embraced the NDIS?
I'll start with that. One of the things that I've actually indicated in my role as Commissioner, because I started to see, so what makes me want to go in this space, I start to see industrial issues, because we now have small bits, whether it's domiciliary care or aged care or small bits of government service looking different. And so immediately it hits my desk because there's workforce issues. You know, unions are up in arms, what's sort of going on. So one of the things that we've done very recently is set up a steering committee that has everyone that you've talked about in government on that, including the head of Community Social Inclusion, myself from a workforce issue, Disability SA, housing, health, we're all there. Early days. And what we've started to do is actually have working groups that are starting to look at their particular sectors. I will take back with me the importance of now bringing NGOs in really quickly, because the bit that we're scratching our head around is, well, who's going to deliver this service? Well, it's the NGOs. You know, are they ready? Yeah, I've heard Peter loud and clear. It's not necessarily, no, I can say it's not my responsibility, but I have a voice on that group and we can talk more about it. It's early days. The bit that I'm actually running is what we call the best service framework. And that's actually, so we can actually put, because we've had transforming health, we've got the justice reform area, and the one thing I wanted to kind of at least capture is that we're in a different kind of transition as a sector, as a society, and what we want to do is capture what is the best framework. We know what the eastern states have done around commissioning and whatever. What does that look like for South Australia? Because we're different. And so I'm dealing with industrial issues. Should we get the unions in early on? In the eastern states they did, and it worked really well because we helped problem solve together. So the framework will advise, I think, on when do you get your partners in, and for us it's like almost immediately. If it's 2018, we need to be working now and might be late anyway. So we'll have that developed. soon, as in February. We're hoping to kind of present that, and then we're on in terms of discussing it. So I just wanted to kind of leave you with we're thinking about it and from a lot of different angles, and now we actually have to bring all the parties together to start working together. So I'm hoping we've got a breakthrough, because we have no choice. It will look very different.
Okay.
Well done.
Peter. It's good. I guess that's a really good example of an initiative like NDIS that starts and comes rolling over the hill, and everyone plays catch up, both within federal and health organisations everywhere. But
the problem in government, and probably any big governments, is, well, NDIS is community social inclusion, so we're going to all sit and kind of, and transforming health is, the problem of that particular CE. Well, it isn't. The only reason I keep getting called in is because when we're time to implement, I forgot to talk about the workforce issues and what's going to happen. Well, we should have talked about that a lot sooner. And if you got the unions in, we could have actually been talking about some solutions together. So I think that's where the silos won't work in the future, because in fact it is all about joined up, because we may not even be in some of that business. But at the end of the day, the person with a disability or the person looking for a house is going to say, oh, I didn't know my service had gone, so what do I do now? And I've got this money, and we're going, oh, well, we've thought about it to this degree. So I think it's something that's quite significant.
Perhaps I could just, before we throw it open again, just change back to a couple of issues that were raised earlier. And one particular one I think that was interesting that was raised before in Joanne, your presentation, was about the colocation, and the fact that was so critical to the success of that particular project initiative as it is at the moment, and down to even the nitty-gritty about the coffee that you talked about. But that was a really good opportunity you had to bring that team together in that sort of really face-to-face relationship. And that's a critical success factor for your initiative, it sounds like. But what happens across the whole of the public service? I mean, it's not always possible to co-locate people. That's the nice option, and I think the task teams, Ruth, you talked about, and I think some of the work that we talked about earlier this morning about redesigning workplaces, etc., within the public sector to create more spaces so that teams can come together, collaborative teams, and trying to generate that flexibility, the innovation, different ways of working. But how do we take that critical element and encourage people across the public sector to work with community and not-for-profit in a much more flexible, adaptable way? So I'd like to throw that up into Joan.
I think the future is there for us, and probably the country do it anyway. In some respects, they might not actually be there, but I think I would like to see in the future that instead of having a police station with 2 people sitting in there, you've actually got CAMS and families and DIPTI and the Victim Support Service and one of the NGOs. You could really have that functioning from one building in a country location very easily. I think that's the future of us all working together, especially with what our forecast will be economically and still maintaining our workforce.
Okay. Ruth, you want to?
Yeah, look, I'll just make a couple of comments about that. People probably have read in the paper about the refurbishment that's happening in the State Administration Centre. And,
or Hansard.
Yeah, or Hansard. So don't believe everything you read in the paper. Having said that, my Chief Executive, Kim Winter-Dewhurst, is very clear about different ways of working and collaborative ways of working, and we are and have redesigned a level in the State Admin Centre which is just completely open plan, so no executives have offices, including him, and we all have a Surface Pro and a phone, so a tablet and a phone, and basically and a locker, I'm told, and that's pretty much it. So the intent is that we can be very mobile and work in collaborative groups wherever we are, and his vision really is that will start to cascade through the public sector, and I think, again, his leadership around that is really important. It also happens to save a bit of money, because if you can, if you've got that kind of floor arrangement, then in the end you can actually reduce the number of floors that you're on, so I think that's important too.
So can I just ask, is that a hot desking type approach, that you can sit anywhere you like, you just come in and if there are so many places available?
That's right, and the intent is that you sit in different locations depending on what you're working on that day. So there are some areas that have collaborative space, so they might have tables that are close together or couches or that sort of arrangement, and then there are other breakout rooms that are quiet areas. So Each day you think, well, you know, do I have a day today where I'm collaborating with people, or am I doing some quiet work, therefore I need to sit in a different location? So it is a hot desking arrangement. You don't own a desk.
Great.
But can I just say, I think it's important too that you prepare your workforce. Before we started MAPS, I did actually engage with the police union, which is a really powerful union. We've got, I think, 99% of police officers in the union. The PSA, the NGOs. I did speak to lots of NGOs beforehand. It just was the matter of when. Family court. So we really were very broad with who we actually engaged with before we started. The reality was we didn't know exactly how we were going to look when we started, so it was just giving them an insight that we're going to start, this is how we're going to do it, it's going to be very different.
Okay, great. Have we got any other questions? Got one to ask for Arman in a moment, but any other questions at the moment? Okay, yes, we have one over here.
One for you.
In terms of the individual funding, it does occur to me that there might be an increased number of people going to the public advocate and requiring a mediated way to communicate with a government. So is the public advocate's office also being involved early on in collaborative communication?
Yep. So what's the role of the public advocate? How do they get involved? You know, at what stage?
Has that been considered? Because it just seems to me that there may be an increased need for that, or public demand for that role.
Great, thank you. Who'd like to respond?
I
Peter?
don't think it's just the public advocate. One of the major lacks in the implementation, I suspect, is the NDIA, the agency, have not established mainstream negotiations with state governments. So the negotiations about getting the money, but in terms of ensuring access to services and what rights and that clients are going to continue to have. The second phase of the NDIS is the local area coordination. That's being put out to tender progressively across Australia, and the LACs, one of their roles, as I understand it, will be to establish those kind of negotiated arrangements. So I think there's a long way to go, and yes, there may well be resourcing issues. Essentially, the number of people with disability isn't going to change. What is going to change is for the first time, they might have adequate resourcing. So I think that's the change that's going to happen, and they may have a greater sense of their power and autonomy. So in that case, they won't necessarily be asking the public advocate to advocate on their own behalf. They may well be able to afford their own lawyers.
Okay. Getting back onto some of the issues that were raised earlier, there was a lot of talk about legitimacy, there was a lot of talk about authorisation, going through the various presentations, etc. I was going to ask this question to the panel, and I'd like to address it initially to Arman and to Fran. Do you think people feel they have enough permission to partner, permission to go and actually interact with other agencies? Arman, coming from outside, you've worked with a number of agencies and departments, as you mentioned about. How easy was it for them, or did they feel, in terms of collaborating and working together? They may have worked, I gather you went and worked individually with a number, but how did you see them working together from an outsider's perspective?
Well, if I can, I guess, share a couple of different perspectives, or a couple of different stories to answer that question. One is, if I was to go back a number of years ago, what we found extremely frustrating is every different agency that we spoke about, we needed to repeat ourselves, and so obviously going through the traumatic experience of getting told you're going to get burnt alive, you don't necessarily want to repeat that story. So and actually, to be honest, that carried right through to even after my mum's death. The different agencies that we were speaking to, we still needed to, repeat the stories and constantly go through the same details. So that we found frustrating. But I guess moving on from that and speaking about the foundation and how we went about, setting this up as a collaboration, because I really look at the foundation as a central hub. So we have great relationships with the not only the metropolitan DV services, but also the regional DV services statewide. And we really rely on them to, I guess, send their clients our way. And so we're trying to create a bit of a win-win situation. So at the same time that we help their clients, they're helping us because we're putting these successful programs together, and we're, I guess, serving their clients who are our clients. So I think that's that collaboration, that communication, and as I did say before, we really work as a system. So as long as we're all on the same page and working towards the same thing, then it's all well and good. So I'll leave it at that unless there are any comments or questions.
Thanks, Emma. Perhaps before we do, throw it open. Fran, you had some interesting quotes there from public servants and people you'd responded.
I mean, I think clearly if you want good collaboration, it has to be part of the system. It hasn't got to be that an individual has got to be a hero of collaboration. It's got to be a systematic approach. We want this agency to collaborate here around this. We will support you to do that and give you resources to do that. People respond to structures. That's one thing we know in public health. It isn't about what individuals do, it's how we all respond to the structures that we're in. And from my research reading and my research experience, when you see collaboration working well, it's got those. We looked at the work in Noarlunga, which has been incredibly collaborative over the years, and looked at, it is about a good leader who leads that, who gives the staff enough rope, to be able to go and do that. It is about having a structure. It is about having resources. It is about having agency support. If you don't have that, this isn't about a hero, who's going to be wonderful. It's about people who work well in systems that encourage collaboration. And I think we have to look at how well is our system encouraging collaboration, which agencies are doing it well. As I say, I think health's withdrawn from it, particularly around prevention, but I'm sure, we see other parts of the public sector where things are happening. And Irma, one thing I do challenge is I don't think change always does take a long time. Sometimes it does, but sometimes change can happen quickly. And there's lots of, my original training was in history, and there's lots of examples in history where change happened really quickly. So I think, we have to balance that too. Sometimes it takes a long time, sometimes it happens quickly. But if we don't have structures to make it happen, to support people, to encourage people, to reward them, to let them be in a trustful environment, it ain't going to happen.
Anyone else got a quick comment on permission, the permission factor, or not? Following up on that?
It's easier to ask forgiveness.
Okay.
Just one quick thing. Policing's always on, I suppose we deal with crisis and emergencies in particular. And it's one thing I always say is you've got to build your collaborations and your relationships early before that crisis, so you've got to have that in place. So that's the permission. You build that up first and then you collaborate.
Okay, thank you everyone, and thank you to all. We're running towards the end of the program, so I'm going to have to call it a stop now for questions, but thank you very much. Please stay here for the moment, ladies and gentlemen. What I'd like to do, I just want to touch on a few key points that have come out this morning, and then we're going to hand over to Tony Lawson. But just in summing up, it's really interesting that some of the themes that came through today, and particularly the issues of flexibility. Ruth, you were talking about the different models, the different approaches that are obviously being started and tried within the public service, the change projects, etc., and how they're going, and they're interacting. And a number of those, I understand, are also engaging not-for-profits and industry as well. They're starting to broaden out, so really good. The need for understanding and building trust was raised in a number of presentations, and it was interesting. I think, Joanne, you mentioned with the group, just getting everyone together, you got a lot greater understanding of just how those other agencies worked. And certainly when I was in the public sector and left and went, I thought I had an understanding of the not-for-profit sector, but it's only when you actually work with that sector a lot, you understand how much more there is to know. So a lot of more learning and understanding that could be shared. No one size fits all in terms of looking at these types of projects and initiatives. Getting people in at the start, that's a really interesting one that was raised there. When's the right time to involve others? how many people actually sit and say, when they have an initiative or a project that they're starting, and ask the question, who else needs to be involved, at this time? And perhaps we need to think a little bit more about that. The issues of legitimacy, authorising, interesting comments about embedding. We have the change initiatives going on. We have a number of other collaborative projects there around the place. Interestingly, if you've listened to some of the dialogue recently about research and innovation between universities and industry collaborating, and I'm sure, Fran, you're involved in this, a lot of talk and a lot of universities will say we're doing lots of it, but the question is it actually embedded in the mindset, in the collaborative mindset of the organisations? And of course, to finish off, leadership, of course, which was mentioned, is absolutely critical. Shared leadership, leadership that actually will support a collaborative environment, support and empower people to actually go and collaborate and work together effectively. So thank you very much, everybody. Hopefully that's a summary of some of the key points that have come out. Thank you very much to our speakers. I'm going to hand over now to Tony Lawson as Executive Director to wrap up proceedings. Thank you very much.
It's my role to formally thank all our speakers and panel members today. So I'd like to thank the Minister for her opening remarks, which were really insightful, and I spent some time with some other people putting together some very extensive notes for her, and then she arrived this morning. She said, I don't refer to speeches or notes. I thought, thanks very much, Minister. But she said that she got a good context from the stuff that we presented. So I'd like to thank Ruth, Irma, Fran, Peter, Joanne and Armin for their very insightful presentations and responses to questions. It's been a really good, I say start for us anyway, for IPPA, but obviously people in this room have been on this journey for some time, and we hope that we can join that journey and continue to be a part of it. In that regard, you will all receive by email a feedback form. So we would like you to be really honest about how you thought this event went today, and that will include questions about the sorts of training, professional development, and any other ideas you might have about future events. We will collect that feedback. It is my intention to write a thought leadership piece about this event today, highlight some of the key issues and where some of the future directions might be, not just for us but for government as well. And we would hope to get something like this on the Senior Management Council agenda and have a conversation with them. Other people I'd like to thank is my council, of course, the IPPA staff team for putting together this event today, another very professional event. Thank you, people. And the staff of Change at SA, and particularly Jess for her role, and the 90-day project team that I work with, as I indicated at the beginning of the day, and Anglicare SA, and particularly Beth and Peter for really grabbing this idea with two hands, and here we are today. In lieu of speakers' gifts, we will be making a small donation to an organisation called Time for Kids that I know quite a bit about personally, and I think that's about it. So thank you for all your contributions, your participation. Thank you for coming. Enjoy the rest of the day.